Hello, everyone. Today we'll be talking about fear. Did you know that fear is an emotion? And you focus on fear so much, you can become paralyzed. So you got to shift that mindset and be positive. Yes. So today we'll have a little chit chat. We will talk somewhat in the experience of a nurse and her journey in nursing. I'm Dr. Marie Smith, the host for Empowering New Nurses. So I just want to reassure my young nurse, my new nurse, that fear is normal. Yes, it is, but we cannot dwell on it. We have to move forward in spite of it. So I've been there. I know exactly what it looks and it feels like to be on the unit for the first time, to get a new procedure, to participate in a new procedure that you've never done before, and your patient requires it. Yes, you have to seek help. Don't pretend. Ask for help. And of course, the person who gives the assignment, the charge nurse, she has the responsibility to assess where you are and in her assignment also give you what you're capable of doing. And sometimes, depending on the situation, you have to be stretched, but you must seek some help if you have never done the procedure before. So there are different fears that you experience as a new young nurse. Fear of just feeling inadequate, fear of feeling that you don't know enough for that situation, that case, that diagnosis, that patient. You also may have fear of making a mistake, and that's okay because you want to do right. And you also have fear of being questioned, fear of not feeling adequate for that particular case, and multiple of other fears you will experience. But as you grow on the journey, you will find they gradually fall away, they gradually disappear. However, within your nursing span, you will find out that fear comes back on and off, especially if you have to deliver some care that you've never had to with a particular situation or experience. And so we have to keep learning and keep growing. And that's why we need to have our mentors. And that's why we have to have good relationships that you can lean on. You can ask questions. Mentorship is always recommended for any nurse because we all don't know it all. And some areas you might be practicing in and you have that experience, some others don't. And so it's important to collaborate, to integrate, and learn from each other and practice. Now, fear, as I said before, can be paralyzing. So you have to get out of that mindset. You may have fear of having a difficult patient. You might have thought that your assignment going to be different. And in your opinion, you got the worst patient. But get some help. I just want to welcome you to this empowering new nursing platform where we equip, we uplift our nurses. We encourage you to do well in so many different ways so that you can provide high quality care to all patients with excellence and, of course, with a purpose. So, today, my encouragement to you is to make sure, make sure you embrace positivity. Make sure that you have a mentor. Make sure you have what? You have what it takes to interact with others. It's important to interact with others, to be a good team player. Yes, especially now when the shortages are real, you ought to have developed and embrace whatever it takes to help you to grow in your nursing career and be able to fight any battles that come, the battles that come, and they will come in your time. But you should embrace positivity. Yes, be a positive nurse. Not every time the assignment might look fair, but guess what? You will learn from your experiences. And one of the reasons I encourage my young nurse to be visible, not to stay in the back when activities, when challenging cases are around. Push yourself, be a part of it, because your time will come. And then you will have gained some experience that will help you to cope in difficult cases. Yes. So don't play at the back, come in front. And practice makes progress. You will just get better and better. You don't have to wait for fear to disappear, but you move forward in spite of the fear. And I'm going to say that for emphasis again. I looked up different information and I was captivated by that, where it says, fear, don't wait and fear. Don't give in. Don't wait until it disappears, but move forward in spite of the fear. Because you're being given something within you to be positive and to move forward. That potential you have. So you don't have to fear, because fear can paralyze you. You'll want to move forward, and because you're fearful, you lack. You're lacking something. But if you move forward by faith, you can succeed. And you know, one of my favorite Bible texts is found in 2 Timothy 1 and 7. It says, the Lord has not given you a spirit of fear, but of power, of love, and of a sound mind. So we're able to think, we'll be able to reason, having the rationale behind what we do. Important, very important. So today, if you don't have, if you have forgotten your takeaway, I'm reminding you not to wait and fear. Don't wait until fear disappears to move forward. You have the potential, you have a purpose, you have a passion to be successful. You will be, so long as you step on fear. And you're going to step on fear in many ways. You're going to lean on someone who has more experience than you. You're going to read. You're going to equip yourself so that you can be strengthened and so that you will be able to provide excellent care with a purpose. Thank you so much for listening. Now, don't forget to put a like, to subscribe, and to follow Empowering New Nurses. This platform was made for you and with you in mind. You're going to share this with others, young and old, experienced and those who are not too experienced, because we all can be empowered together, learn together, share together, and offer high quality care to all patients because all patients deserve care with dignity, respect, and value. Today, I implore you to provide high quality care to all patients. I'm Dr. Miriam Smith, the host for Empowering New Nurses. See you on my next episode. Thank you.